Hello and welcome to another edition of Renal Cab. Today I'm going to be picking up some 3 students, it looks like. Let's see how they do. Hi guys, how you guys doing?
Good, how are you?
Good. It's pretty cold out there, isn't it?
Freezing.
Alright, so where are we heading today?
South Central College.
Good. And can I get you guys' names so I can know you on a first name basis?
Yeah, I'm Jennifer.
I'm Tara.
I'm Maru.
Alright, I'm Nicole. It's nice to meet you
Nice
guys.
to meet you.
So I see you guys are in scrubs.
Yeah, we're nursing students.
Oh, well, you know what? Today is your guys' lucky day because you guys are in Renal Cab. Yeah, so we're going to be going over some conditions that are associated with renal dysfunction.
Awesome.
All right, so let's get started. So you guys are heading to South Central back there?
Yeah.
Okay.
Yep.
All right, so we're going to start with acute kidney stones. So can you guys first off tell me what are the functions of the kidneys?
I got this. Urine formation, excretion of waste products, regulation of electrolytes and regulation of acid and base balance, control of water balance, control of blood pressure, renal clearance, regulations of red blood cells, synthesis of vitamin D in its active form, secretions of prostaglandins, regulation of calcium and phosphorus balance.
Very good. Yeah. You know, the kidneys do a lot of things, so it's very important that we keep them healthy. All right. So, acute kidney stone. What is an acute kidney stone?
Right.
Kidney stone is caused or forms by crystallizations within the kidney. And as these crystals stay within the kidney and are not passed through the urine, which they can, they will form smaller ones, which eventually leads to one large kidney stone. And then that can cause further kidney complications.
Very good. Yes, you got it. All right. And what causes acute kidney stones, and where are the corresponding stones that may produce?
Yeah. So kidney stones are caused from substances, high concentration of minerals such as calcium, magnesium, oxalates, and phosphorus. When they become highly concentrated from not drinking enough water, family history, an unbalanced diet, certain medications can cause them. There's certain types of kidney stones that are formed. We have calcium stones, uric acid stones, Christine stones, and struvite stones.
Oh,
Good job, Jennifer. Good job.
Yes, you guys are getting it.
Got it.
All right. So,
We're doing good. Keep
how do the
going.
kidney stones affect the urinary system?
I think I have this. As a kidney stone goes down the urinary tract, it may stuck in the urinary tract and block the flow of the urine, and then may cause severe pain and blockage of the urinary flow, which is urine retentions, and excessive bleeding.
Yes, and where is it usually blocked in the urinary tract?
The ureter.
Very good. All right. So, what are the signs and symptoms of acute kidney stones?
Ooh, I got this because I've had one. Okay. Excruciating pain. A lot of times it can be in the lower back. You can have blood in your urine, frequency and urgency of urination, painful urination. You can have an odorous urine, which would be a sign of infection from that kidney stone, nausea, vomiting, and then you can also get some noted abdominal bloating or swelling.
Right. Yes. Very good. Yes.
Good job, Tara.
Yeah. You know, kidney stones can be very painful, as you have said. You've had them, so you know.
Painful.
All right. Let's see.
Do
Do you know the treatments of acute kidney stones?
I think I have this answer. Some small stones can pass its own, but you may take pain medication for it because it may cause some pain. And the other treatments should be drinking excessive fluids, like 8 to 10 glasses of water per day if there is no contraindication.
Mm-hmm.
And if the stones is very large and it cannot pass out through the urine, the urologist may take some treatments to remove or break it down into small pieces by doing shock wave lipotropsy, urotoscopy,
Laparoscopy. Yep, it breaks
and
it down.
percutaneous nephrolasectomy.
Very
Yes,
good.
yes. Oh,
Yes.
you covered it all, Marie.
Yes,
Good
you guys
job.
are doing
Good job.
great.
Good job.
All right, and who are more susceptible to getting kidney stones?
Yes. Okay. I think we're gonna go with the answer. Caucasians are more susceptible to getting a kidney stone, and it's more prevalent in men versus women. Usually by the age of 40 in men up until their 70s, and then women, I think it's age 50.
50. There you go. Very good. Yeah.
Good job.
All right, so we're almost halfway there to South Central College. What are some diagnostic tests used to confirm the presence of kidney stones?
I'll answer this one. So usually they use x-rays to help determine the location. They use sonograms, ultrasounds, an IVP, which is an intravenous hologram, a 24-hour urine test, and blood chemistry, which will help determine the composition of the stone so we know how to treat it.
Very good.
Yes.
Very good. All right, so nursing diagnosis for acute kidney stones. Can you list two and their corresponding goals and interventions?
I got this, I think. Impaired urinary elimination related to anatomical obstruction with the evidence of blood in the urine. The diagnosis, the nursing goal for that will be void in normal and usual pattern. My nursing intervention for that will be increase fluid intake up to 8 to 10 glasses per day if there is no contraindication. And diet change and exercise will help. My second acute kidney diagnosis will be acute pain related to tissue trauma, edema formation, and cellular ischemia. My nursing goal for that will be decrease pain to acceptable levels, and my intervention will be determine and note the location, duration, intensity, and radiation of the pain, and warm applies and implement comfortable measures like back rubs, restful environments.
Okay,
Good.
very
I want you
good.
for my nurse if I get
Yeah, if I could get a back rub, then I don't mind the acute
You
kidney
got
stone.
it covered.
All right. So, chronic kidney disease. Define in medical terms what chronic kidney disease is.
I have this one. Chronic kidney disease is any disease that causes the kidneys to function less efficiently than normal, and it can last, it's diagnosed usually after 6 months or more of having the complication. And it is a progressive disease, and it is irreversible.
That's right.
Oh, yes.
Good job.
Yes.
Yay!
All right. So, there are modifiable and non-modifiable causes of chronic kidney disease. Can you guys give examples of each?
Yeah. Some modifiable things are things you have control over, such as your blood pressure, your diabetes, infections, blockage of the urinary tract. Taking NSAIDs or a high fat or protein diet are all modifiable. Non-modifiable are things you have no control over, such as your genetics, family history, your age, your gender. Men are more prone for this also, and premature birth.
Men.
Men. Yeah, you see, that's something that we see common between the kidneys. It's men are more susceptible to this. Okay, so what are some signs and symptoms of chronic kidney disease? There are a lot today, but just name a couple that you can. Most important.
I got this, I think. Decreasing of urine production, which is oliguria. Increased serum creatinine and blood urea nitrogen. Edema, nausea and vomiting. Weight loss, lower back pain, edema, anemia due to decreased production of erythropoietin, metabolic acidosis, shortness of breath, weak bone.
Weak bone, yes.
Good
Very
job,
good.
Mom. Good job. Oh boy, I think we got this.
You guys are doing really good. We're almost there. The questions are dwindling down. You guys are doing fantastic. So after being diagnosed with chronic kidney disease, what can be done to slow down the progression? Because we know that it's irreversible. All we can do is slow it down. So what are some measures that can be taken?
Maintenance of any of the underlying causes that have led to your chronic kidney disease would be like maintaining control of your hypertension, your anemia, your hyperglycemia, quit smoking, watch your diet, lose some weight if needed, start an exercise program, and reduce your salt and alcohol intake
Very
will
good.
also help.
Yes, very good. Yeah.
Nice.
Yeah, and it's important to, make sure you're keeping on those medications for your hypertension and all that stuff. Otherwise, some pretty bad complications can arise.
Yes, very
Yeah,
important.
yeah.
Very important.
All right, so there are 5 stages of chronic kidney diseases. Can you guys tell me a little bit more about those 5 stages?
That's
That's one of the worst.
Yeah. So the 5 stages, they're based on a GFR, which is the amount of plasma filtered through the glomeruli per unit of time. So stage 1 is the least severe. It's anything with a GFR greater than or equal to 90 milliliters per minute. And it progresses worse as you go. So 2 will be worse. That's between 60 and 89 milliliters per minute. 3 is between 30 and 59 milliliters per minute. 4 is 15 to 29, and 5, which is also end-stage kidney disease or chronic renal failure, is less than 15 milliliters per minute. People on the stage 5 are usually on dialysis.
Very good.
Yes.
Yes.
When you get that point,
Yeah.
Yes,
Good job,
awesome.
guys.
You
Good
guys are
job.
doing great. All right, so we are almost there. I think I can see it down the way. We're almost there, so let's get these questions done. And if you get it all right, you guys were all getting scholarships, $2,000 worth for your schooling.
We only have 2 left. guys.
2 left, so
We gotta
you
do
guys
this.
can get it right. Okay, so what types of tests are used to diagnose chronic kidney disease?
There's a lot of tests.
Okay, I got this thing. Blood creatinine test, which estimates the rates of glomerular filtrations. The normal value for the serum creatinine is 0.6 to 1.2 milligram per deciliter.
Okay.
And the blood urea nitrogen test, which was the normal value of 7 to 18 milligram per deciliter. Urinalysis and urine test will help to diagnose.
Awesome. You're doing very good. All right, last but not least, here we are with the last question
Oh my gosh.
of your
No pressure,
drive.
guys, no
Okay.
All
pressure.
right, nursing diagnoses again. 2 possible nursing diagnoses with their corresponding goals and interventions for chronic kidney disease. Go.
Okay, I think I can think of this one. This is tough though. These nursing diagnoses. I'm gonna go with excess fluid volume related to decreased urine output, dietary excess, and retention of sodium in water. Now, a goal I would utilize for this patient would be to maintain an ideal body weight and without excess fluid buildup.
Okay.
An intervention I would use would be to definitely assess my patient's fluid status, limit their fluid intake as prescribed per the doctor, and then explain to the patient along with the family the importance of following their fluid restrictions to
Very
prevent
good.
further complications.
Great.
Okay, and then a second nursing diagnosis could be related to activity intolerance, related to fatigue, anemia, and retention of waste products.
Very good.
A goal I would use for this patient would be to participate in activities within their tolerance, and an intervention to make sure that they can reach this goal would be to assess factors that contribute to activity intolerance. I would help them to reach independence and self-care activities, and also assist if they're fatigued, and encourage alternate activities along with rest.
Very good. You guys got them all right. I want high fives myself. You guys did awesome.
Yes.
We will discuss more of this later, and I'll get your information on your scholarships. And here we are at South Central College. Thank you for joining me on Reno Track. It was great. You guys were awesome. Thank you for participating.